Hospitals in Canada are run like businesses with budgets that have to be balanced. There's no shortage of clients, but there can be a shortage of cash. And when governments freeze those budgets, hospitals have to make do or look elsewhere for money. That's exactly what a handful of hospitals in Toronto did, going outside Canada to find paying customers. As Krista Gomansik reports, it all happened quietly until a nurse started asking questions.
Ontario advertises to tourists all over the world. The government wants visitors to come and spend their money. It's good for business, and sometimes that business happens to be healthcare. Pierre Leplan has been nursing for some 40 years. Today, he's semi-retired, but still working overnight shifts here at Toronto Western Hospital. In the spring of 2012, Leplan started asking questions about some patients from Libya.
I was point blank told at this stage of the game that they were bringing in revenues for the unit. Point blank, it was said. It was
You were told this is about revenue
generation
for this hospital.
Absolutely.
Leplan discovered that the University Health Network, known as UHN, had quietly launched an international patient program. Part of that program? Bring in patients from other countries who either pay for the treatment themselves or get their government to pay for it.
And I said, where's the informed consent of the Canadian public for this?
Medical tourism being done in a publicly funded hospital.
I don't feel as a nurse and as an Ontarian and as a Canadian that I was properly consulted on having these patients brought here as a source of revenue generation, which is what we were told emphatically and repeatedly.
Turns out that since 2011, the University Health Network has treated 621 foreign patients from 23 different countries, generating revenue of nearly $30 million. Another big Toronto hospital, Sunnybrook, also saw an opportunity to bring in cash. In 2013, it too launched an international patient program, openly marketing to foreign patients on its website. But UHN had even bigger plans. CEO Dr. Bob Bell put them down in writing. The American medical tourism market exceeds $5 billion, including Americans in UHN's international patient program would double program revenues within 2 years. In Windsor, Ontario, Canadian patient Mike Jubinville had no idea Toronto hospitals were allowing patients from other countries to pay for treatment. The optician is very familiar with the Canadian healthcare system. He suffers from chronic pain caused by uncontrollable muscle spasms, a condition called cervical dystonia.
It just affects your neck, and it's basically the neurons in your brain are overactive. It's sending a signal that it shouldn't be sending.
Mike is a medical tourist himself. After years spent searching for a diagnosis and waiting to see specialists in Canada, he chose to leave and go to the United States for treatment to relieve his neck pain.
I did get in quick. I mean, my wait times were not months, they were days.
Mike paid for those procedures to the tune of more than $60,000, something he couldn't do here as a Canadian patient in a public hospital.
Of course I would want to stay in our system. I can't. No, I wait. I pay and go to the States.
Kelly Malosh helped Mike find that treatment in the United States. She runs a business sending Canadian patients across the border, about 300 every year.
Mike had to go to the U.S. to get the health care he needed.
Because Windsor is just across the river from Detroit, Michigan, the city is a jumping-off point for outbound medical tourism.
Mike can't pay here in Canada. Every Canadian that goes over there, they've already made the choice that if I can get the health care that I need, if I can feel better, if my quality of life can improve, then I'll pay for it if that's what it takes.
Malosh was also surprised to learn about Toronto hospitals making money from foreign patients. If they can pay for timely treatment, why not Canadian patients?
They should be able to pay for treatment, absolutely. And it's a win-win-win for everybody. Then let's create it so it's fair for everyone. Fair for the doctors, fair for the hospitals, fair for the patients, fair for everybody.
While Canadians may be proud of our universal, publicly funded healthcare system, Malash says it's broken. To reduce wait times, it needs more money. And medical tourism brings in money. It's estimated there are millions of patients around the world spending billions of dollars every year. At trade conventions like this one, countries drum up business for their healthcare facilities, and at least a few Ontario publicly funded hospitals are competing in that global marketplace, shopping for patients. The nurse who went public about UHN's paying patients says it shouldn't be allowed. Is your concern here, is it medical tourism, or is the fact that it's medical tourism without Canadian knowledge?
It's medical tourism without Canadian knowledge.
Canadians, Ontarians, did not make a deal with government of funding the healthcare system through their taxes to treat people from abroad that simply get ahead of the line because they have money.
Once they found out about UHN's profits from international patients, a coalition of nurses, doctors, and midwives quickly organized to stop it.
We immediately call on the Ontario government to ban medical tourism in all its forms in the province of Ontario.
We believe in a system that is based on need, not on ability to pay.
Our healthcare system is founded on this principle of equality, meaning that you can't and shouldn't be able to jump the queue just by producing a credit card.
Dr. Nazar Mohammed is the orthopedic surgeon who manages UHN's international programs. He defends the hospital's efforts to bring in cash.
From our perspective, the definition we're working with is that humanitarian is providing health care to people who don't have that access within their home jurisdiction.
And he objects to the term medical tourism.
This is not medical tourism in the sense that we're having them come here for vacation. This is providing life-saving and critical care.
But at the end of the day, it is a foreigner paying for medical service.
Mm-hmm. Correct.
So it's a revenue-generating procedure.
Yes.
So it doesn't really matter what we call it. It's still somebody paying.
Somebody has to pay because we have to make sure that Ontario patients are not impacted by this activity.
Dr. Mohammed says the money benefits Ontario patients.
We have opened up 2 dedicated beds for inpatient care at the Toronto Western Hospital, which are open 365 days of the year. We've also been able to open up an additional operating room with some of those funds.
So there's been no Canadian tax dollars that have gone into that?
No, that's absolutely from the revenues generated from this program.
How do we know that no Ontario patient was bumped for this individual? There's no information for the public to look at.
Well, I think we've taken great care and lengths to create a process whereby we ensure that no Ontario patient is bumped or disenfranchised by this activity.
Hospital's not a private business. It's not a private club. You can't decide what you will and you won't disclose.
But here's the problem. Tracy Tremaine-Lloyd, a lawyer specializing in health law, says there's no proof Ontario patients weren't bumped.
Is that really true? Or are they actually utilizing operating rooms and staff and equipment during hours that could be going to reduce the wait list? We don't know the answer to that.
She says there's no transparency, no accountability, no money trail.
So we should know, here's how much we generated from these programs. These were the hours that we did. These were the types of procedures we did. And if so, when you've got the money, where's it going? Show me, in other words, show me where the money's going.
Well, according to UHN's CEO, there is a money trail. UHN's Board of Trustees receives a report on a quarterly basis about our international activities, the revenues that come to UHN, and how these revenues are spent. 16x9 asked for those quarterly reports that supposedly lay out all the numbers. We had to file an FOI, Freedom of Information request. To our surprise, when the answer came back, we were told they don't exist. Instead, we took the financial statements that are available to the public to a chartered accountant. We wanted to find out exactly how the nearly $30 million in profits from foreign patients was spent, but found nothing.
There should be a separate set of books available to show us and a separate financial statement to demonstrate what came in and what went out.
This lawyer says taxpayers need proof that any profits being made are going back to help Canadian patients.
To help the delivery of healthcare, not to salaries, not to middle management salaries, not to more money for the CEOs or other people managing the system. It's got to go into the delivery of the healthcare. So medical tourism, yes, it can help. It can help the economy as long as they're not bumping Ontarians out of the queue in order to take the money-generating patients.
This is privatization by stealth.
Opinions are a little more heated in the halls of the Ontario legislature.
This is a huge ethical issue for this province.
When will you introduce an outright ban on medical tourism?
A ban hasn't happened, but there might be a pause. In November of 2014, Ontario's Minister of Health and Long-Term Care, Dr. Eric Hoskins, sent a letter to hospitals. I am requesting that hospitals not market to, solicit, or treat international patients, with the exception of international patient activity related to a hospital's existing international consulting contracts. The government plans to find out exactly what the hospitals are doing to make sure they're not using public dollars for international patients and no Ontarian is displaced. After the health minister's letter, perhaps because of public backlash, Sunnybrook Hospital quietly shut down its international patient program. Marketing material disappeared off the website. The University Health Network says it will comply with the government's guidelines, but it is still open for business from international paying patients.
It's not a private business, it's a publicly sponsored healthcare system. We're the shareholders in this business. The public are the shareholders. We have a right to know.
We understand the buck, so let us know what the buck looks like, and we'll tell you where the buck stops.
Next.
My name is Renelle Harper.
An interview with a reluctant face of a movement.
That they were bringing in revenues for the unit. Point blank, it was said. It was
You were told this is about revenue for this hospital.
Absolutely.
LePlante discovered that the University Health Network, known as UHN, had quietly launched an international patient program. Part of that program? Bring in patients from other countries who either pay for the treatment themselves or get their government to pay for it.
And I said, where's the informed consent of the Canadian public for this?
Medical tourism being done in a publicly funded hospital.
I don't feel as a nurse and as an Ontarian and as a Canadian that I was properly consulted on having...
Times, that business happens to be healthcare. Pierre LePlante has been nursing for some 40 years. Today, he's semi-retired, but still working overnight shifts here at Toronto Western Hospital. In the spring of 2012, LePlante started asking questions about some patients from Libya.
I was point blank told at this stage of the game.
Hospitals in Canada are run like businesses with budgets that have to be balanced. There's no shortage of clients, but there can be a shortage of cash. And when governments freeze those budgets, hospitals have to make do or look elsewhere for money. That's exactly what a handful of hospitals in Toronto did, going outside Canada to find paying customers. As Krista Gomansik reports, it all happened quietly until a nurse started asking questions.
Ontario advertises to tourists all over the world. The government wants visitors to come and spend their money. It's good for business, and some